Well, hello everybody. My name is Dr. Chelsea Deal, and I'm going to be giving you an introduction to iron deficiency anemia, a very common diagnosis that we see in hematology. So by the end of the session, you should be able to describe the function of iron, list the key players in iron storage and metabolism, describe the signs and symptoms of a patient with iron deficiency anemia, and list the common causes of iron deficiency. So the most important component of a red cell, and that which gives a red cell its color, is hemoglobin. So hemoglobin is composed of 4 globin chains, each of which contains a heme ring. The main adult hemoglobin is hemoglobin A, and is composed of 2 alpha and 2 beta chains. So it is hemoglobin, and specifically the heme ring, that's responsible for oxygen and carbon dioxide gas exchange. So note on the right diagram the iron atom that is at the center of every heme ring. So it is iron in the center of the heme ring that binds oxygen. So without iron, we cannot synthesize adequate hemoglobin, and thus we become anemic, which will be defined later. Now, what in our body controls the level of iron? Iron stores are primarily regulated through absorption, a phenomenon that's illustrated in the diagram on the right that shows a gut cell. So there's a few key players in this process that are good to know. One reason being that these are actually measured in the laboratory. So our first one is going to be ferritin, which is our primary iron storage molecule. It's predominantly present in cells such as liver cells and macrophages, but a small amount is present in the blood, and that's actually what we can measure in the laboratory to get a sense of the patient's iron stores. Transferrin is, as the name implies, the iron transport molecule in the blood. And then hepcidin is our primary iron regulatory molecule. It's designed to block iron export from cells, block iron absorption from enterocytes in the duodenum, which you can see on the diagram on the right, and also blocks iron release from macrophages. So hepcidin is an interesting molecule. Its synthesis is decreased in times of increased iron need, such as iron deficiency or hypoxia, or increased erythropoiesis, which refers to red cell production. But it's increased with iron overload and when inflammatory cytokines are increased, such as with infection or any inflammatory state. The thought is that this molecule is designed to prevent microorganisms from gaining access to our iron, such as what happens with infection. But any state of increased inflammation can do this, and this is said to be the mechanism behind anemia of chronic disease, which is another subtype of anemia that would be discussed separately. So as I said before, these key players can actually be measured in the laboratory, such as serum iron, transferrin level, which is sometimes reported as total iron binding capacity, or TIBC, transferrin saturation, or iron saturation, and serum ferritin, and these are collectively known as the iron panel or iron studies. Different names are used in different institutions. The ultimate end result of iron deficiency is anemia. Physiologically, it's defined as an insufficient oxygen carrying capacity in the blood to meet the oxygen requirement. Clinically, which is used more often, it is defined as decreased hemoglobin or hematocrit compared to a reference range or reference population. Iron deficiency anemia is one of our microcytic anemias, as you can see in the table on the right. Microcytic anemias mean a smaller than normal sized red cell, usually due to an inability to make hemoglobin. And due to the lack of that hemoglobin imparting that red color, these anemias are often also hypochromic, which means their central pallor is widened. You can see in that picture down below where that central white space is much wider. So what are the signs and symptoms of a patient presenting with iron deficiency? So the primary symptoms are those related to the anemia itself, which are common to all causes of anemia. So first, patients often present with fatigue and shortness of breath or dyspnea on exertion, and this is due to the decreased oxygen supply to the tissues. Additionally, patients can present with rapid heart rate or palpitations, because the body is trying to compensate and increase oxygen supply to tissues by increasing cardiac output. Also, patients can present with pallor, so not having that hemoglobin to impart the red color makes us pale. And there's certain areas where it's best assessed, like the conjunctiva or the nail beds shown here. Some rare symptoms and signs that can be more specific to iron deficiency include glossitis, or soreness of the mouth and tongue, or angular cheilitis. You can see these sores and cracks in the side of the mouth. That can also be seen with megaloblastic anemia, so it is not 100% specific. You can also see koilonychia, which is referring to these spoon fingernails. They have sort of a concave spoon shape. They're much more friable and brittle. And then pica is what we often see is a craving for unusual foods and substances like ice or dirt. It's very, very common. So when it comes to iron deficiency, it's very important to establish the cause because it could be something quite significant. Blood loss is most common, specifically GI blood loss, very common from malignancies to peptic ulcers to intestinal infections in certain parts of the world. And I think this is important to stress because iron deficiency in an adult man or postmenopausal woman should be considered due to a GI malignancy until proven otherwise. So it's very important to ask if they've had a recent colonoscopy. Menstrual and pregnancy blood loss is common, especially in women of childbearing age. So it's very important to get a thorough menstrual history. Urinary loss, blood loss is super rare. Frequent blood donations. This is certainly not to discourage anyone from donating blood, but donating frequently can be a source of iron loss if it's not supplemented. Inadequate diet's rare in the U.S. apart from one important exception, infants who have an exclusive cow's milk diet. Iron in cow's milk is not as readily absorbed as breast milk or formula. Additionally, cow's milk can actually irritate the GI tract and cause a little bit of bleeding. So I've seen infants come to the hospital with profound anemia due to this. Another important cause of iron deficiency is times of increased iron requirement or demand. So certainly growth spurts, kids and adolescents who are growing require a lot more iron. Pregnant women require a lot of iron as well. Iron malabsorption is pretty rare, but there can be some well-known causes as listed here, things like gastric surgery or celiac disease, in which there's an area of the gut that's affected that actually is the area that absorbs iron. So hopefully by the end of this video, you've gotten a sense of iron deficiency, and it's a super common diagnosis, so I hope that you have learned something today, and I thank you for your attention.